WJTV 12 is focused on mental health, and a major challenge for some with mental illness is access to care. Now, some can't afford insurance to cover the care they need. Others end up paying out of their own pockets, and some don't get treatment at all. And in all too many cases, they end up on the streets. Joining us to talk about access to care is Costas Matthias with Bridge to Recovery and Jill Buckley with Stupot. And welcome to both of you. Thank you so much for being with us. Jill, let's start with you. I know it's Stupot. Obviously, the homelessness is there. What about when you add with that mental illness? Do you see a lot of that?
Yes, for us and dealing with people who are homeless, sometimes it's kind of a chicken and an egg question. Of course, people who are experiencing homelessness also are experiencing trauma. It's a very traumatic event, and some can, if they aren't already experiencing some mental illness, can develop some level or form of mental illness while they're on the street.
I can see that.
For some people, it's kind of the catalyst. It's what pushes them out onto the street, either because of medication, lack of medication, not taking medication, not having family support, or burning bridges. So it's for us, it can be a little bit of both. It's people are homeless because they're mentally ill, or because homelessness is so traumatic. It can also kind of create a kind of mental illness.
So what do you do in those cases? Is there, can you pick up a phone? Who do you call?
We have really strong partnerships with Hines Behavioral Health Services, who provide all level and manner of support for agencies who are serving people who are experiencing homelessness and for people who are homeless. So what we can do is that we can kind of triage. We can provide with emergency services and make sure people have a safe place to sleep, they have a good meal to eat, they have clothes to wear, but also we can connect them with the resources that are out there. So it's just really important for us, as kind of the first line of defense, to have really strong partnerships with other agencies that are there who are there to help people with those kinds of.
Bridge to Recovery is an outpatient program, and we specialize in treating adults 18 and older who are struggling with addiction, such as alcohol, drugs, eating disorders, other destructive compulsive behaviors, and mental health issues. And within that setting, we really focus and emphasize the importance of treating the entire family, because addiction impacts everybody that it touches, everybody that comes in contact with addiction and mental health issues. And so that's one of the important aspects that we really try to encourage and support. And the other aspect of Bridge is not everybody has an addiction. There are some people that may be suffering from or struggling with life in regards to a divorce or postpartum or grief and loss or some kind of traumatic incident, and being able to provide help for those individuals.
And how about negotiating the insurance part? Because we know, as we said earlier, some have insurance, some do not. And how do you deal with that? Do you help the patient?
In regards to accessing?
Yes, in dealing with the insurance aspect.
Yes, we help individuals because we are a private facility and we work with commercial insurances. But anybody who calls, my goal is to help them with a resource to be able to get the help they need. We don't get off the phone until they have a name and a number. And so many of the individuals that I speak with don't have commercial insurance, or don't have the financial resources to be able to access the care that's needed.
I can see that would be one aspect of that, but I like knowing that you don't leave them without somewhere to turn to.
Absolutely.
How about the whole, if they are on medication, Jill, when you see them, isn't it a problem that they stay on the medication, that some, they have to have it and they have to stay on it, and we find that so many don't?
Sure, and I think that's a problem across the population and not just for people experiencing homelessness, right? But I think, to your point, that for people experiencing homelessness, maybe like getting actually their medication in hand and taking it regularly is really more of the challenge, because there's so many aspects of life that they're trying to manage at that same time. And so again, there are resources in our city, in our capital city, for people, but it is, I mean, there's so many other kind of intersecting kind of struggles, like access to transportation. Can people get to Hines Behavioral Health or Jackson Hines Comprehensive Health to get to see their case manager or their psychologist or counselor? So what we try to do is try to be nimble enough as an organization to help some of those. Help kind of close some of those gaps, right. So not every agency can do everything, but the trick is to try to, like I said, be nimble enough to kind of figure out how to get the people the help that they need in a way that doesn't, compromise the other programs that you're trying to also offer.
Costas, with Bridge to Recovery, you said with the families. It's a family affair. Families, though, have put up with a lot oftentimes.
Absolutely.
With these, sons, daughters, husbands, wives, whatever, sisters, brothers. How do you get to them to say, no, we all have to deal with this?
Well, we encourage them and support them in really recognizing that not only is this person, do they have the problem, but the pain that the addiction has also caused them, it's that they also deserve to heal. And so it's kind of like when a person is given the opportunity to be heard about what they've experienced in relationship with this person who's struggling, then it's somebody listens to them when all the focus has been on the other person.
Right. What about trauma? What role does trauma play in substance abuse?
Major. What I have found is that most individuals that we're treating are addicted survivors of trauma. They've either experienced some type of traumatic event, or they have a mental health issue that has not been diagnosed or hasn't been treated appropriately. And so it's looking at, okay, well, if it's not treated, then they start to engage in possibly high-risk behaviors that's dangerous. They might encounter trauma.
So it really goes hand in hand. The homelessness can cause trauma, but probably what put them on the street was trauma to begin with, in a different a different regard. What about getting them? Would you say in the Jackson area, in the Tri-County area, that more resources are needed? What I have heard is that there doesn't seem to be one clearinghouse of where you can just, this is coming from some of the physicians too, that, I have a patient, but they need to come, but that doesn't happen. So sometimes they end up without a place to go. Does that happen?
Absolutely. I mean, there is not a place in our city that detoxes individuals. The individuals that need detox, they have to either go to Meridian or they go to Vicksburg or Hattiesburg or Laurel.
Why in the capital city do we not have that? $1 million question.
Million-dollar
I guess there's a lot of questions. We thank you both for being here and adding even more to this web special. But obviously, it's an ongoing battle. We want to stay connected. We want to pursue this more in depth. We realize that this isn't. Certainly, this isn't even a drop in the bucket, but at least it is saying there are resources out there. You don't let one go without another phone number of somebody that can help. You are dealing with them and helping them access what they need in order to get the help that they need on a daily basis, Jill. Jill and Costas, thank you so much for being here. And we will have more on this subject as we continue our Mental Health Awareness Week.